this sort of track today, what I was looking for when I called for all the speakers that I went out to, was really an understanding of the diseases that many of us had when we were children: measles, mumps, rubella, chickenpox, all of those things that have vaccines created for them, we go into the pediatrician's office these days, or most people go into most pediatrician's office, and the pediatrician tells you, oh my goodness, if you don't get the measles vaccine and your child gets the measles, they will die from the measles. And, you know, you look at that and you listen to it, and I grew up in England, and not that England makes a difference, but I had measles, mumps, rubella, scarlet fever. I had everything under the sun, and I'm alive. And it's just as a side note, my kids got whooping cough this year, and my older daughter goes, I got whooping cough and I'm alive. And so what I really wanted to do with this track today was dispel that fear, and recognize that these childhood diseases, and that's what they are, they're childhood illnesses is really what they are. And we go into other ones that vaccines are for, but these childhood illnesses are not scary, in that if you know the symptoms and you know how you can treat them, you don't have to be scared of them. And so I talked to Myra, and she said, you know, I'd like to do a talk on measles. And I said, absolutely, you know, let's look at how measles is not scary. And so that's her talk. She is a homeopath in the Bay Area. She's studied homeopathy. She also uses gemology and other things. But, you know, for me, it's just really looking at sort of the alternative ways rather than relying on a vaccine. And we all know that vaccines aren't 100% safe, and they're not 100% effective. So most of the people getting measles, mumps these days, whooping cough, are fully vaccinated. So even if you vaccinate, I would say come sit in on this talk, or listen to what Myra has to say and what's going to be said today, because you can still get them even though you're vaccinated. So I'm happy to introduce Myra, and happy to have her here, and I'm looking forward to hearing what she has to say. Thank you.
Thank you. I'm happy to be here today and have this talk. And I just want to say, I have for everyone who's here, I have a little gift for you. It's not homeopathic, it's actually anthroposophic, but it's a well-being cream, and it has some homeopathic remedies in there, and you massage it over your heart to feel better. So I'll leave this here for you to come get at the end. So what I wanted to do is give a little introduction to homeopathy, and in the context of a childhood disease. And this can be applied to any kind of illness that someone might have acutely. And I wanted to give the family kind of a way to feel safe using homeopathy. Now, how many out there are measles survivors? Great. So we have examples of people who've lived through measles. And when I was a child, you were expected to get the childhood diseases, and the family planned for the children to have those childhood diseases, and it wasn't considered traumatic. And I actually am not a measles survivor. I was 8, and I have no way of really understanding what happened to me, but I was given a measles shot, which was just developed, and I actually developed a rash and an illness, and I couldn't go on a trip with my mother. I had to stay home with a babysitter because my father worked, because of this illness that I had. And my doctor, my pediatrician, said it wasn't measles, but it happened shortly after the shot. And I actually stopped reading for a while and had to learn how to read again. So I don't know. I mean, to me, now I think, well, that was probably a vaccine reaction, but I don't know. You know, there's no way to go back in time and figure that out. So today I want to talk a little bit about an overview of homeopathy, the role of childhood diseases, a review of measles, when to seek help, some homeopathic remedies that can be used for measles, how to give homeopathic remedies, and just a brief introduction to homeoprophylaxis and cease therapy. And I want to say that I also have a handout that I believe will be available on the download. I have two handouts. One's kind of an overview of homeopathy, and the other is about different remedies to use for measles than what I'm covering to here. So you'll have a broader toolkit to draw from. So homeopathy was founded by a German physician named RSHomNA about 250 years ago. So it's an alternative medicine that is Western. When we think of alternative medicines, we usually think of Eastern medicines, but we have a Western medicine, and it's based on the findings of Hippocrates and the law of similars. And as far as I know, and maybe some of you can correct me, that homeopathy is the only system of healing based on the law of similars. I know the anthroposophic remedies, they use homeopathic remedies, but they use the law of opposites, which is the same as Western medicine, which is the same as herbalism, and the same as Chinese medicine. And the law of opposites was actually also a law that Hippocrates discovered. So it's an interesting contrast. And so the law of similars means that the remedy choice, this is where it's always difficult for me, the remedy chosen matches the symptoms the person is having if they were to take that remedy in gross form. But the way the homeopathic remedies are prepared, it will elicit the opposite effect and actually heal those symptoms rather than counteracting and suppressing them like the law of opposites, like taking an aspirin for a headache. Doesn't really make the headache pain go away, it just masks the symptoms. And I'll talk a little bit more later about how homeopathic remedies are made, but one example I can give is coffee. When you drink too much coffee, you get jittery, your mind races, and you can't sleep. And there's a homeopathic remedy made from coffee called Coffea cruda. And in homeopathy, they use the Latin names for all the homeopathic remedies because it's the international scientific standard. But coffee made in a homeopathic remedy will take those racing mind and insomnia and a lot of those symptoms away. So that's just a little example. They're natural and holistic. They look at the person's totality of symptoms, and they act as a catalyst to stimulate the body's self-healing mechanism. That's how they work. Oh, and I wanted to point out how long homeopathy has been in the United States. So if we look at that little picture in the corner, and maybe I should have made it better, that's an actual statue of Samuel Hahnemann that was dedicated to the United States at the turn of the 20th century by President McKinley. And it's there today on Scott Circle in Washington, D.C. Has anyone seen it? Yeah, so it's the only statue of a physician on Scott Circle. So homeopathy uses the smallest dose needed to elicit the maximum effect without causing harm. And they're not all plant-based. That's a kind of a misconception. People kind of confuse homeopathy with herbalism sometimes. There's also mineral and animal-based remedies used in homeopathy. And they're not all the remedies, most of the remedies are FDA approved, and they're made in pharmacies and labs. And so the secret to what gives homeopathic remedies their power is the potentization process. And the common misconception is they're just diluted. and so it's placebo and there's no effect. But that's not really true. These numbers down here, these are the potencies or the strengths of the homeopathic remedies, and you can see the X and the C and the M, and those are Roman numerals, and that indicates the dilution scale. And then the numbers, the 6, the 30, and 200, etc., those are how many times they've been gone through the potentization process. So if we look at the 30C, which is the common one I'm going to talk about in this talk, how that is made, the C is the dilution scale. So they take all homeopathic remedies are made into a mother tincture before anything is started. And I'm a little nervous because I see some of my expert colleagues in the audience. But this is just an overview, and it's not meant to thank you. Okay. So they put 1 drop. So you start out putting 1 drop in 99 drops of water or alcohol. And that's where you get your 100, or the C part. And then it's succussed, which is a rapid shaking with a bang on the end. And I like this little image because, and this is from one of the pharmacy's instructions on how to succuss. They're banging it on a book. And you need an elastic hard surface to bang on, so they recommend banging it on a book. But in the original making of homeopathic remedies, they used a body of text that Samuel Hahnemann created to instruct homeopaths how, to teach homeopathy, and it's called the organon. So traditionally, remedies were succussed on an organon, and I also heard that they were also some homeopaths succussed on the Bible, but whatever you succussed on was supposed to imbue certain attributes to the homeopathic remedy. And there's still some pharmacies that hand succuss today. So you succuss it, and then you go back to the, so once you succuss it, that's 1C. Then you have to take 1 drop of that 1C and put it in another 99 drops of water or alcohol and succuss it again, and that's 2C. And you go through that process 30 times, and you finally get to the 30C. And that's how minute the doses are. But it's that repetition of diluting and succussing that gives the remedies their power. So homeopathy, and I think this map is out of date, but homeopathy is used by about 70% of the world's population in over 36 countries. I think the most widely used holistic practice is herbalism, and homeopathy is the second. And it's very strongly used in the Netherlands and India. And I just want to go over the natural disease cycle for childhood diseases. So there's an exposure period and an incubation period and an infectious period, and somewhere, depending on the disease, the incubation and infectious period is different, and somewhere in there it's contagious. And then there's symptoms that develop as the illness is mounting, and the body's reaction is the fever, and then the discharge of the disease through either a skin discharge or perspiration, and then there's resolution, and there's usually some successful outcome. And if we look at measles and specifically for a successful outcome, in homeopathy, as in what Patricia was talking about earlier about diseases, homeopaths see disease expressed in the physical, mental, emotional, and spiritual realms. And the role of disease, which Kate talked about, is resolving inherited weakness and developing resistance and becoming stronger in ourselves. And it's usually followed by a growth spurt, either a mental or physical growth spurt. And then from Neil Miller's book, he spoke yesterday. In his research, he actually documented some of the successful outcomes of the natural measles society, of contracting the natural measles illness. And he confirmed that contracting measles makes us more resistant to certain cancers as an adult. Anyway, these are the studies that confirm the anti-cancer link between having measles, the natural form of measles in the wild, and a resistance to cancer. So in the measles cycle, there's an exposure period, and the incubation period is 7 to 21 days. They might start with a chill or a fever. And in measles, the contagious period is 4 days before and 5 to 10 days after the rash appears. It'll start with the Koplik spots, which are white pustules inside the cheek, which are unique to measles. There's a skin eruption, a nasal discharge, maybe photophobia, a sensitivity to light, and eye tearing, and perspiration, and then we get the resolution and the benefit of having the disease. So here's a kind of a picture of what Koplik spots can look like, and also a typical skin rash. What I think causes fear in people around measles are the unusual symptoms. And the unusual symptoms are complications that are usually not caused by the measles disease itself, but by a complication. And I just wanted to make people aware of them because they don't happen often, but people should be aware of certain conditions that might arise where you might want to seek help and go beyond home care. And I also want to encourage you that anytime you're uncertain is a time to seek help, because you want to be confident in how you're treating your loved ones who are ill. And home care in measles, this is something I think we've lost in our society, is tending to the sick and convalescing and having a supportive environment to nurse a sick child or a sick family member through their illness. So it's important to tell them what's wrong and reassure them. Reassure they'll get better. Encourage bed rest. Provide a well-ventilated dark room. Give plenty of fluids. And give small nutritious meals, which Sally Fallon has been teaching us what those are, but only if they're hungry, because in homeopathy we listen to that. We listen to what the person is telling us while they're sick. And if a child is not hungry, we don't want to force feed them at that time. And vitamin C can be helpful. So to tending to the rash, we want to avoid scratching. Sometimes a cold compress can help make the rash feel better and less itchy. And sometimes oatmeal baths in cool water can help. And instead of buying a prepared oatmeal bath that's on the market, I recommend that clients take rolled oats, run them through the blender, about 1 cupful, and put them in the water. And the reason I say that is sometimes the prepared oatmeal baths can have additives that children are reactive to. Also, I used to recommend using cornstarch as a powder to kind of help create a barrier between clothes and the skin, but so many children now are allergic to cornstarch that arrowroot powder can be used as a substitute. And of course, you don't want to put that on an open wound or anything. That would be put on dry skin. You can just have a little bowl of it with a cotton ball, and the child can put it on themselves. It can be a distraction to keep them from scratching. You want to keep if they're scratching and a rash becomes a sore or infected, you want to keep it clean. You can use a compress of 1 part calendula tincture and 3 parts water. You can cover it lightly with a gauze if there's a concern about keeping it clean. And you can make a cool chamomile compress for the eyes if there's eye symptoms. And you can do that by getting a high-quality chamomile tea and steeping it and letting it cool and dip it in gauze. Dip gauze in the tea and then wrap it in a cool washcloth. So and I also want to say, you might not need a homeopathic remedy. If the measles symptoms are mild enough, you can just let the child recover on their own. But if they're needing help, there's many homeopathic remedies that can be used if you know what you're looking for. And I hope to show you a little bit of how that's done. And the remedies that are checked are the ones that I'm talking about. So there's no one homeopathic measles no one homeopathic remedy for measles. And these remedies can be used in other childhood diseases as well. It's the symptoms have to fit the homeopathic remedy. And as we can see by that little picture down there, there are many homeopathic remedies packaged many different ways. But the ones I'm going to talk about are the common ones you can find in these tubes here by Boiron, because those are commonly found in the stores. And I'm going to talk about the 30C potency because that's the most common ones that are found. So now we're going to put our detective caps on, and we're going to learn how to distinguish a homeopathic remedy. And we have to remember that disease expresses itself on many levels, and we have to be aware of the onset, what was going on at the time the child got sick, and what's the location of their complaint. If they have a sore throat, what side of the throat? Is it on the left side? Is it in the back? Is it all over? Or any other kind of pain? And how that pain feels to them. Is it a cutting or a burning pain? You know, we need to all observe and be good detectives. And what's the intensity of that pain? And also, when is it worse? And when is it better? What time of day? Or what makes it feel worse or better? And then we want to observe the child. How do they look? How does their face look? Do they look kind of out of it and limp, or are they more active and they don't want to lie down and they want to move around a lot and play? Do they want the window open? Do they want the window closed? We have to be aware of all those symptoms because those give us the clues to select a good remedy. And we want to listen to what the child says and what they're asking for. Are they asking for cold drinks? Do they want lemonade? Do they want warm drinks? All these things are important. Or what are they saying about how they feel? And then we also need to know what questions to ask. And so now we can put our detective cap on and look at some remedies and see if we can make a distinction to choose a homeopathic remedy. So I want to talk about aconite first, and I also talked about aconite in my handout because I think this is the most common remedy in an acute illness. And you probably, if you're just starting out and you don't know what to do, you probably can't go wrong with starting with aconite. It's often, the causation is often after shock or fright or exposure to cold, which can be considered a shock to the body. The symptoms come with a sudden onset of symptoms, often a high fever. In measles, the rash is bright red, rough, can burn and itch. There also can be a dry, barking, croupy kind of cough along with it, and a thirst for cold drinks. And aconite is monkshood, and you can see the little blue flower over there. So it's a flower, it's a plant remedy. It's not a flower remedy, but it's a plant remedy. But these are some of the common characteristics of someone needing aconite. And now I want to talk about an animal remedy here, and my example is going to be apis, which is made from the honeybee. And if we can think about what a bee sting looks like, it gets red, hot, and puffy usually. So we're going to see that in the face, and the eyes may be red. But the rash, which is the important eruption of for the discharge of measles, might not be well developed. And the child might cry out in their sleep. They won't be able to tolerate heat, and their head might be drawn back. Now, I would say if the head's starting to draw back, you might consider seeking help. That could be a sign that there's a complication with brain inflammation. And so I would give apis and take them to the ER, maybe. But so apis could be a good remedy for measles. So we have another plant remedy, and it's called euphrasia or eyebright, which gives us our clue that it's a good remedy when there's a lot of eye symptoms. And sometimes in measles, it starts with a lot of eye symptoms, a burning, watery discharge that is burning to the eyes. And there might be a bland discharge for the nose. There might be sensitivity to light, excessive blinking, and a headache that's in the forehead. And sometimes euphrasia is a good remedy at the start of measles, because sometimes we see these symptoms at the beginning stages of measles. And again, it doesn't matter if it's measles. You know, this could be a good remedy for another illness too. And then I want to talk about, just cover a mineral remedy, which is phosphorus. And for phosphorus, we'll see a lot of symptoms that end up in the chest, like lung congestion, maybe some wheezing. There'll be rapid respiration and pulse, maybe a bright red flush on the cheeks. They'll be craving cold water, but they'll vomit as soon as it warms up in the stomach, and they might crave ice cream and sparkling beverages. And there might be some fears. So this is the mental realm. There might suddenly a child who maybe outgrew the fear of the dark might start having a fear of the dark again, or maybe they haven't had fear of the dark. They might have fear of the dark or fear of loud noises. Those are some of the fears that could indicate phosphorus. And this is how I tell my clients to give a homeopathic remedy as a test. I use, again, the 30C potency, and I have them drop 3 pellets in a half cup of water, and I stir and have them give a spoonful every 15 minutes for a 2-hour period. But after each spoonful, I ask them to stop and observe. And is the child getting better? And better could mean they fall asleep, or they maybe get hungry. That could be better too. But if there's any alleviation of symptoms, we want to wait and see and watch very carefully and see if we need to repeat. And if they're not better in that 2-hour period, then you just discontinue that remedy and go to the next one that you select. Because there's no point in giving more of a homeopathic remedy if you're not seeing a result. Which is, I find, kind of interesting when clients come to me and they go, well, I went to the health food store and I picked up this remedy for my cough, and gosh, I must have been taking it every day for a month and I still have the cough. And it's like, well, it's time to move on. That's maybe not the right remedy for you. So, and then a brief word about homeoprophylaxis. So this is a way, and Kate's talked about this, this is a way to educate the body about measles by using the wild measles made into a homeopathic remedy. And it educates the body about the disease, so when it sees it, when it comes across it, it knows how to respond, and it might not get it, or it might get it in a milder form than it would have. But homeoprophylaxis has been around since the time of Hahnemann. It's not new. Dr. Isaac Golden is considered one of the leaders. He's an Australian physician, and he had a 6-year study with homeoprophylaxis with leptospirosis in Cuba. But again, you would want to get homeoprophylaxis under the guidance of a trained homeopath. And then I just want to introduce cease therapy, which is a way of treating symptoms that come from a vaccine, which is a combination of detox, isotherapy, and homeopathy, which was developed by Tine Smits in the Netherlands. And it's been very effective for, it was actually created for post-vaccination syndrome, but it's used for illnesses that start from other substances too, not only medications, but chemical exposures and other things. So this is another method of using homeopathy, but again, you'd want to use it under the guidance of a trained homeopath. So are there any questions? Yes? Oh, do you want to come to the... Thank you.
So you mentioned earlier about measles, getting the measles and having it be preventative for certain types of cancers. Is it possible that measles as a disease can be used in treatment for cancers? Has anybody looked into that?
Using the homeopathic remedy?
Or using the disease itself, measles, as a treatment. Has that been something that anybody's looked into? Like,
Kate can answer that.
Thank you.
I was going to say Neil Miller probably can answer that too.
Actually, the Mayo Clinic in Minnesota has done some studies using measles to treat cancer. And we haven't seen the publications of that because actually what it means is going to turn the vaccine paradigm upside down on its head, and there's political reasons for not doing that, but they have been doing that. Yeah.
Yeah, thank you.
I have a question in the preparation of the homeopathic tincture tablet.
Oh, you mean to create it?
Yeah, whatever that word was.
Potentization.
Thank you.
Yeah.
Okay, so you said it's either done in water or alcohol, and I'm wondering why you choose either one.
It depends on what the substance dissolves in.
I see.
Or
so it's water soluble.
The method used. Yeah.
Oh, okay.
So, or it could be a combination of water and alcohol.
Okay. Okay.
Yeah.
And then the 30 times you do.
Well, you don't succuss it for 30 times.
Succuss.
It's a process of diluting and succussing it 30
Okay.
times. Yeah.
So succussing, is there any number of times that you do that? or is that irrelevant?
You know, I've actually seen different ways. I've visited one pharmacy where it's very quick, just like a couple of times, and I've seen other preparations where it's longer.
Okay.
Just a question about Bach flower remedies and how you might use those.
How I use those in my practice? Well, I use them as an adjunct, and I don't mix them with homeopathic remedies, but I just use. So the Flower Essence Society has photographs of flowers, and it's called the Affirmaflower method, and that's the method I use. So I have a little bigger kit, but I mainly use in my practice a Bach's Healing Herb Kit, which is his original flower essences. And I have the client look at the photographs and pick out 6. And then I prepare a flower essence remedy from that.
You do a combination?
I don't mix the homeopathic. Yeah, I do a combination of flower essences, but I don't mix the homeopathy. And I do that as a complementary service in my practice. And if it's a child, I like to give one to the whole family. I like to go through the process for the whole family. I think because it helps the family be part of the healing process, and also sometimes children are sick because of a maintaining cause, which is actually the family dynamic, and it can help shift the family dynamic.
So in treating a child, I would imagine that perhaps you're thinking broader with the whole family. Do you offer at times support to the other children or to the family members because they'll be in the same household with the same pathogens? So what kind of support would you offer to other people in the home?
You mean if they're bringing the child? I mean, it's nice if the family is all going under the constitutional homeopathic process together, but that doesn't always happen. But sometimes I do give adjuncts to other family members, and sometimes I don't. It just depends on the situation.
Do you have a common go-to to maybe help support the immune system in those folks in the same home?
I educate my clients about the cell salts, the homeopathic cell salts, and I do suggest that they can use those freely without worrying about complications. Yeah.
Thanks.
So. Well, yeah, come up to the speakers because they're recording.
This may be a little off topic, but in terms of chicken pox, and that might be opening a whole new can of worms, and shingles, as a child I had chicken pox. Then as an adult I got shingles. Is there any way to, since I don't take vaccines, in hindsight, should I have prepared myself for not getting shingles, or is there, I did take some homeopathic remedies after I got the shingles, which helped me through it, but is there anything you can say on that topic that might not be too large, or is that too big a space?
So, Deborah, are they doing homeoprophylaxis for shingles? Yeah, so I usually give the varicella nosode if I'm working with somebody with shingles. At the end, I give them the varicella nosode to kind of seal it and portify.
The other thing about shingles is that it speaks to a cancer risk.
So it's the thing with the weakened immune system. So in constitutional care, when we see adults, especially I think it's under 50,
Right.
We want to look at working with the immune system
Yeah,
to alleviate that risk.
that's right.
Yeah.
Yeah, there are different miasms. Then we get in a whole complicated discussion about in homeopathy and chicken pox and shingles are under the cancer miasm, and it would dictate someone should come for constitutional care. Any other questions?
So both my kids have had I have had one shot of the MMR. Can you talk about, like, I saw that you had some recommendations for detoxing from, like, the vaccine itself.
Yeah, so that's
and then also, how vulnerable would they be as well to getting measles and then going through that? And then can you tell also about maybe a situation where you've had families come in and the steps you've gone through and the different medicines that have worked? And I saw that you listed those, but like an example of, like, you tried this and then you went on to something else, or and how many?
I don't really have an example of that.
Yeah.
So cease therapy is individualized. And as are homeopathic remedies, as you can see. And so in working with anyone with homeopathy, you work out the most likely remedy, and then then you give it and you see the response, and the response tells you what to do next. That's a homeopath. That's the way homeopaths work. And so if you're not sure, like, is it aconite or is it apis, you go with the most likely one, because they won't harm you, especially giving them this way. You can feel safe giving them this way, and you can try it out, and if you don't see improvement, you can just move on to the next one.
And with the amount of kids that you've helped, you've seen that the homeopathic medicine has been effective?
Oh, yes. Yeah, absolutely. Yeah.
You haven't had to go to the ER
No.
as frequently or as often?
No, and no. Yes? Yeah.
Oh, I'm sorry. Go ahead.
Well, we have time for everyone, so, yeah.
Okay. Kind of following up on what she was just saying, could you talk a little more about the cease therapy?
Oh.
Because you mentioned...
I wasn't really going to talk about cease. I just want to orient people to it, but I will if we have time. Yeah.
I know your focus is children, but I wonder, and adults perhaps, but also pets. I've used homeopathics, the Boron brand, and the same idea. I don't put it in water because it's really hard to do water with animals, a cat particularly.
Oh, I find it easier to do water for cats, but that's okay.
Well, I do one pellet and then I see, but one of the ones that I've used for cats that have had a lot of stress in their life toward the end of life is ferrum phos. Is that pretty safe also for children?
Yes, ferrum phos is good for children, and I actually, for my clients, recommend as a home remedy, as a go-to remedy when a child is starting to get sick, or any family member is starting to get sick, is to give ferrum phos in a 6X, which is a very low potency, called the tissue salts. And actually, I actually have a number of clients who go to the health food store, pick it up, take it in the parking lot, and then they report back to me by the time they get home they're well. So it works very quickly, or it can work very quickly. But cease therapy. So if a client comes to me, I give them tools to use. based on the situation. And it's individual, and it's hard to answer some of these questions in this kind of format because it really is individual. But yes, homeopathy works great with animals. I've had, with my own animals, a lot of good success. Yeah. That's right. Yeah. And those are just like, this is not an exhaustive list of symptoms. These are common for measles, let's say, or some other illness. But so the materia medica for phosphorus can be pages and pages and pages and pages of symptoms. So this is just to give you an overview. And I know it's kind of misleading when you go into the health food store and you see the label that has one symptom on each bottle, and you think, oh, this is the panacea, this is the magic bullet, like this will cure all my coughs, and it's not true. There's labeling laws, and they have to put something on the bottle, so they put what the manufacturer perceives as the most common symptom for that item. And over the years, I've seen the same remedy from different manufacturers with different descriptions. So the more you study, the more complicated it gets. But I'm just trying to break it down to give people an easy tool. And in the handout, the download handout, there's more instruction. The one that is supposed to be available on the download. What do you mean by download? We're supposed to, we're to submit papers and handouts, and then they're going to have them on a link so people can download the talks. And I have 2 handouts that are different from my presentation. Cease therapy. So cease therapy, again, is detoxing kind of a substance that has made someone ill out of the system. And it starts by opening up those detox pathways from the organs, because you can't start detoxing unless the pathways are open, because where are the toxins going to go? They're going to reabsorb somewhere else. So it's a method of using different things, and it can be a supplement or an herb or another homeopathic remedy or a flower essence to open those detox pathways, and then giving the substance that made the person ill in a homeopathic remedy to detox it out, and then a homeopathic remedy, more of a overall or constitutional homeopathic remedy to support the whole person during this detox process. And one of the reasons we open up those pathways are to prevent the aggravations, the Herxheimer aggravations that can happen in a detox process, like brain inflammation and skin issues and liver issues, things like that. But now we're getting complicated. I don't know how far to go. But I haven't done a lot of clients with vaccine injuries in my practice with cease. I've done it more for substances that have made them sick, that have made people sick, the iatrogenic diseases that happen that people say, I've never been well since I took this antidepressant, or I've never been well. I've never been well since I worked in the car wash that summer in college and got exposed to all those petrochemical cleaners and stuff. Those are the kinds of ways I've used cease. I What's interesting, I did have a child come to me that had eye tics after getting the flu vaccine. And we didn't even get that far. We just opened up the detox pathways, gave a homeopathic remedy, and it resolved it because the body was healthy enough and resilient enough that it just needed a little help to get those symptoms out. In fact, it's been a year and a half since I've seen them, and they just came back, and it's a completely different child. Completely different child. So it works very profoundly.
Hi.
Hi.
Can you talk about fever and how homeopathy works with fever, and when you introduce it, what stage, or do you let it go, or how does that work?
I recommend people let it go. Yeah, depending on the age, let it go high. But then again, it would be the other symptoms. You wouldn't just give a homeopathic remedy because someone has a fever. Right. You would look at all the symptoms to choose a homeopathic remedy. So it's not just the fever that you would work with. You know, like we looked at aconite had a sudden high fever, but there's other remedies that can have a sudden high fever. Belladonna, for example. And so we'd want to look at the other symptoms to decide, are we going to give aconite, or are we going to give belladonna? So any other questions? Great, thank you. And don't forget to come up and get this.